Hello there, kia ora. Last week, the IT staff at Waikato Hospital were told that each of their job is on the line because the government has to underfund our core services to pay for their landlord tax breaks. Then yesterday, Dr. Shane Reti announced an extra new 50 senior doctors to help cut waiting times. Waiting times so bad that it was reported this week that referrals from GPs weren't even being put on waiting lists due to what Te Whatu Ora describe as a lack of resources to be able to prioritise a time for them to be seen. And when it comes to emergency care, in August it was reported some hospitals were taking literally days to see people in emergency departments. In Palmerston North, 200 patients waited more than 24 hours to see doctors in March this year. But don't worry, there's 50 new doctors being hired. Not that that's a quick process. The Capital Coast and Hutt DHB say it takes between March and September to complete the hiring process, depending on the roles. So we're looking at the majority of next year before we see any effects from the increase in staffing levels. And that's before they even start tackling the waiting lists. And 50 new doctors does sound like a nice round number, but that's 1.25 new doctors for each of our 40 state funded hospitals. That's before we look at the other issues on our health system as well that the government's managed to exacerbate. While we have had long term issues with declining numbers of primary health providers, the increase in doctors that are being trained at the moment, whether that's through an increased intake in current medical schools or Waikato University eventually getting its medical school up and running, well, that's going to be almost a decade before the impacts of that are going to be seen. While in March it was reported that doctors here are leaving in droves because they find the current work conditions and support levels unsustainable. It's leading them to feelings of being undervalued and micromanaged and causing high rates of burnout. 80% of GPs had reported burnout, which leads to high levels of stress and depression. And doctors are human, so those baselines can lead them to make mistakes. And sometimes when doctors make mistakes, the results are unfortunately fatal. Oh, but don't worry, if you can't afford to wait on a waiting list that may never get shorter, you could always go private. There are currently about 200 private hospitals around the country, and the problem with these is well, they cost money. There are some cases where the public health system do use private facilities and services, but for that, you need to be seen and assessed, which means you have to go onto the waiting list first. But another wide effect of the current system is more people now needing to look towards private healthcare options, which is why Give a Little has seen $15 million raised for health funding in the last year. A large element of those are directly linked to people being unable to continue paying for health insurance, according to financial advisors who ask people not to think of health insurance as discretionary spending, but in a cost of living crisis, we all have to make tough choices. And don't forget, added into this is a mix of societal changes that are going to continue to add pressure onto the system. We have an aging population, which means more healthcare requirements. Senior citizens make up almost half of all of the services provided within the health sector. And because the way our population is aging, the proportion of older people needing healthcare won't increase, but the physical number who need it will. We also have to deal with other issues, like the fact smoking numbers are increasing for the first time in a decade. Speed limit increases lead to more accidents and injuries, and health and safety work laws are being weakened, which adds to health sector pressure. Oh, and all of our increasingly long waiting lists, the referrals sent from GPs, the medical records sent to and from private providers when someone raises funds for a much needed surgery they couldn't wait for, the work medical staff and health professionals do every day, and the systems that they need to ensure work to be able to provide care quickly and effectively. Well, they need to access a series of IT systems and tools to be able to do that on a range of technology and devices. And for that, you need a strong, experienced IT team, which were called into a meeting this week at Waikato Hospital after they were all told that they could lose their jobs. Our health sector is far from performing the way that we expect it to, and successive choices from successive governments have had their parts to play in this. But 12 months of austerity measures that have seen frontline cuts when we're told there wouldn't be any, backroom cuts when we were lied to and told that they wouldn't impact the front room, infrastructure cuts to the likes of a hospital that had serviced the entire South Island, and stress levels amped up to everyone working within the health sector. So, Shane Reti and Lester Levy can swoop in and play the hero with an extra doctor per hospital, and as much Milo as medical professionals could want is going to continue causing problems. It's playing at the edges of the problems that the government have caused by their financial choices. And when you do that to the health sector of an entire country, the results can be ultimately the most tragic ones you can imagine. Wait, you're still here? It's over. Find another video.